5 minutes to sort it out.
It's often really hard through nobody's fault and through capacity to do the wider kind of holistic approach.
We can refer people onto care and repair or to get a falls pendant.
We can add those visits to help people with exercise classes.
All broad spectrums of people's support needs.
Bus passes, attendance allowance forms.
Make sure there's food and supplies in for when people do return home.
We have quality of time to spend with people.
We can sit and have a conversation with them, and we can have that 10 extra minutes having a cup of tea with them, making sure they're all right.
Just have somebody on the other end of a phone if we have a question. Actually, can I just pick your brains? Can you help? Are you right people? Where can we go if they're not?
Some referrals we have received for access to food.
Engaging with healthcare professionals about treatment care and making sure that the participants understand what's happening.
Some of the nurses that go in and say, "Oh yeah, we've heard of you."
They know a whole wealth of knowledge around community.
Working with all different sections.
Working with discharge team at the hospital, working with housing, working with adult social care.
In order to keep somebody well and to keep that prevention in and out of hospital, it needs to be that social element as well, which is often why we very much lean on each other. With our community health hubs, which we've set up in partnership with Enhance, these individuals are able to get out of their house, come somewhere for 2 hours. It's warm, they get a drink, they have games, they socialise. They're wonderful. It's really nice to get them out and give them a purpose to get out, and also to make sure they are getting the correct things at home.
We've got healthcare professionals in our offices so people can come in, and we add in their social element as well.
With Eileen's problems with her dementia, you know, we don't have a lot of conversation, and so it's nice to be able to talk to other people.
It's because it's social as well as getting the dressings done.
In these environments of the community health hubs, we have lots of eyes and ears.
We find that people tell you much more when you don't ask them questions, when you actually just sit them down and talk about the world, and then things come out. But actually, to be able to add on the early intervention community care element by working with the neighbourhood teams and the NHS specialists, has been able to add another layer of service to really help people.
We had one woman who she'd fallen. She was on a perching stool in the kitchen wearing fluffy socks, and she slipped on the laminate and fallen off. And we asked her if we could press her falls pendant, and she refused. She was terrified that she'd go back in hospital. She only came out of hospital, in fact, a few days prior to this. So we called the Holt Park Neighbourhood Team, and literally 20 minutes later, an occupational therapist was at her door with equipment to help her get up. It meant we didn't have to call an ambulance, we didn't have to take her to hospital, which is what she wanted. She really didn't want to go back to hospital. So that partnership prevented a hospital admission, prevented an ambulance call out. We put her first. She didn't want to go to hospital, so we were going to do everything we could so that that didn't have to happen, and in the end it worked perfectly.
If I can make a difference, I will, and I would do it again and again.
Between us, we all work really well to deliver that service to the person who's needing that support at that time.
We had a gentleman and his wife come and attend. It was his wife that was coming to see us due to her legs, and he was really low. We said, come down, have a cuppa with us, and we'll see your wife at the same time. One of our Enhance partners turned around and said, why don't you come and have a chat with me? Let's see what we can do together. He's now got that real support network around him. We weren't in an environment where you had two people with great knowledge in one room. That would have never have happened if we weren't working together.